This is PowerPoint number 2 of 3. In the first, part 1, we covered the neck and its compartment and associated structures. In part 2, we will start on the head. We'll start our discussion of the head with a brief discussion of the osteology of the skull as it relates to the other structures we'll be talking about. This is obviously a frontal view. Anteriorly, we have the frontal bone that makes up the forehead. Inferior to the frontal bone, we have the orbits. Associated with the orbit is the trochlea. The trochlea will serve as a pulley for a muscle that controls the eye. There is also a foramen that's associated with the orbit superiorly, and that is the supraorbital foramen. Coming through both the trochlea and the supraorbital foramen are both arteries and nerves, which will be discussed in just a few minutes. Below the orbits, we have the nasal bone for the nose. Surrounding and inferior to the nasal bone, we have the maxilla. The maxilla has within it, under the eyes, the infraorbital foramen, also a exit point for arteries and nerves. Lateral to the maxilla, we have the zygomatic bone with the zygomatic arch. There are two foramen associated with the zygomatic bone. That is the zygomatico-temporal foramen and the zygomatic facial foramen. Through those foramen are two branches of the trigeminal nerve that are sensory to those areas. On the maxilla are alveolar processes. Alveolar processes are processes which the teeth insert into. And finally, here's the mandible. The mandible also has alveolar processes associated with it, to which the lower teeth fit into. Also included with the mandible are the mental foramen. The mental foramen have an artery and a nerve, the mental artery and nerve associated with them. Here's a lateral view of the skull. In this view, we can see some of the areas of the skull, such as the frontal, parietal, sphenoid, and temporal areas. Just discussed the maxilla and the mandible. In the temporal area, we have the mastoid process as well as the styloid process. These structures create a foramen called the stylomastoid foramen. The stylomastoid foramen serves as the exit point for the facial nerve, cranial nerve 7. From this view, we can also see the mental foramen that is part of the mandible, as well as the external auditory meatus that leads to the ear. The mandible has a number of anatomical landmarks. The mandibular condyle is the condyle associated with the temporomandibular joint. Anteriorly, we have the coronoid process. The coronoid process is the attachment point for the temporalis muscle that goes from the temporal part of the skull to the coronoid process. It is a retractor and closer of the jaw. On the ramus of the mandible, we have, or the angle, we have some rippled edges. This serves as the attachment for the masseter. The masseter is another muscle of mastication that not only closes the jaw, but also protracts or protruses the jaw. On the inside of the mandible, we see the mandibular foramen. The mylohyoid nerve runs right along this mylohyoid groove. Running through this foramen is the inferior alveolar nerve and artery, which supply blood. The mandible has a number of anatomical landmarks. The mandibular condyle is the condyle associated with the temporomandibular joint. Anteriorly, we have the coronoid process. The coronoid process is the attachment point for the temporalis muscle that goes from the temporal part of the skull to the coronoid process. It is a retractor and closer of the jaw. On the ramus of the mandible, we have, or the angle, we have some rippled edges. This serves as the attachment for the masseter. The masseter is another muscle of mastication that not only closes the jaw, but also protracts or protruses the jaw. On the inside of the mandible, we see the mandibular foramen. The mylohyoid nerve runs right along this mylohyoid groove. Running through this foramen is the inferior alveolar nerve and artery, which supply blood. Here's a view of the underside of the skull. There's some structures on here which will relate to other structures that we'll be talking about in this and part 3 of this series. We have the palatine bone, which is number 7, and the palatine process, number 6. The palatine bone and the palatine process make up the hard palate. We have the zygomatic arch. The zygomatic arch comes back. We have the fossa for the mandibular condyle or the temporomandibular joint. Medial to the fossa for the temporomandibular joint is an important area called the infratemporal fossa. The infratemporal fossa has 2 important foramen in it. This is the foramen ovale. The foramen ovale is the foramen for the 3rd part of the trigeminal nerve. So motor to the muscles of mastication as well as some sensory to the face. Lateral to the foramen ovale is the foramen spinosum. This is another important foramen as the middle meningeal artery to the meninges of the brain runs through here. A medial dislocation of the temporomandibular joint can then affect both the 3rd part of the trigeminal nerve, the mandibular division, as well as the middle meningeal artery supplying blood to the meninges of the brain. The trigeminal nerve is the nerve that provides sensation from the face. The trigeminal nerve, as it sounds, contains 3 main branches. The first branch is the ophthalmic nerve. This goes to the eyes, the forehead, and the nose. Sensory around the eye, forehead, and nose. The maxillary division, or the second division, is also sensory to the upper teeth, maxilla, palate, and below the eye. And then the mandibular or third division is sensory to the lower part of the face, the chin, the cheek, and the posterior superior part of the face, and motor to the muscles of mastication. The ophthalmic and maxillary division are purely sensory divisions of the trigeminal, while the mandibular division has both sensory and motor components to it. Here is a nice schematic of the three divisions that make up the trigeminal nerve. Again, the ophthalmic division comes through the supraorbital fissure. This is all sensory. The ophthalmic division will branch into the nasociliary nerve, which branches sensory from the external nasal and infratrochlear nerves. The external nasal will be sensation from the nose, and the infratrochlear will be sensation to the medial lower orbit. The frontal nerve branches off the supratrochlear and supraorbital nerves. So the supratrochlear nerves will be associated with the trochlea on the superior medial orbit, and the supraorbital nerve will exit the supraorbital foramen. The supratrochlear nerve and supraorbital nerve provide sensory from the forehead. The lacrimal nerve is the nerve to the tear ducts. In the next slide, we'll be pointing out the divisions and the nerves that come from the ophthalmic, maxillary, and mandibular division as they relate to sensation from the face. This is also the handout you received in class today. The maxillary division comes through the foramen rotundum and is also 100% sensory. The maxillary division dead ends as the infraorbital nerve, providing sensation from below the eye. The maxillary division also branches off a zygomatic nerve. The zygomatic nerve will branch off a zygomatico-temporal nerve that is sensory from the temporal and zygomatic area, as well as the zygomatico-facial nerve, which is sensory from the zygomatic arch as well as inferior. The zygomatico-temporal nerve and the zygomatico-facial nerve exit foramen of the same name in the zygomatic part of the skull. The superior alveolar, nasopalatine, greater and lesser palatine nerves will be discussed as we talk about the oral cavity and palate. The mandibular division is made up of both sensory and motor nerves. The sensory nerves in the mandibular division include the buccal nerve, which goes to the cheek, the mental nerve, which goes to the chin, and the auriculotemporal nerve that is sensory from the temporal region of the skull. This graphic is the same graphic as the one in the handout passed out in class. It shows the sensory distribution of the nerves from the trigeminal nerve. In orange, we have the distribution of the ophthalmic division of the trigeminal nerve. Off of the nasociliary branch, we have the external nasal, which is sensory from the nose, as well as infratrochlear nerve, which is sensory from the superior medial nose and medial orbit. And from the frontal nerve, we have the supraorbital nerve and supratrochlear nerve that are sensory from the forehead. In green, we have branches from the maxillary division. The maxillary division terminates as the infraorbital nerve, which provides sensory information from below the eye, as well as the zygomatic nerve that branches to the zygomaticotemporal nerve and the zygomaticofacial nerve. The distribution is seen here, lateral and superior to the orbit, and lateral and inferior to the orbit. Last is the mandibular division of the trigeminal. The three sensory nerves within the mandibular division include the buccal nerve, that is sensory from the cheek, the mental nerve, which is sensory from the chin, and the auriculotemporal nerve, which is sensory from around the ear, the temple, and the lateral cheek. Blood supply to the face comes mainly from the facial artery. The facial artery is a branch off of the external carotid. The facial branches off inferior labial and superior labial arteries, which go to the inferior and superior lip. As the facial artery courses along the angle between the nose and the eye, it is called the angular artery. The other main branch off of the external carotid that supplies blood to the face is the transverse facial artery. The transverse facial artery branches off the external carotid and travels along the zygomatic arch. Secondary arteries that supply blood to the face, or smaller arteries that supply blood to the face, include supraorbital and supratrochlear arteries that exit the supraorbital foramen and the supratrochlear foramen, as well as the infraorbital artery, which exits the infraorbital foramen. This is actually the termination of the maxillary artery. And finally, the mental artery, that is the artery that exits the mental foramen in the mandible. Venous return from the face is via the facial vein. The facial vein branches off the inferior and superior labial veins, just like the artery, and terminates as the angular vein in the face. The angular vein is an important vein as it connects directly to the cavernous sinus within the brain. So an infection in and around the area of the angle of the nose can leach into the angular vein and cause problems in the meninges of the brain.